before that I would discuss the Louisiana regulations regarding labeling. So all drugs dispensed by a hospital pharmacy intended for use within the facility shall be dispensed in appropriate containers and adequately labeled as to identifying the patient's name and location, the drug name and strength, and the medication dose. Also should be labeled with the expiration or beyond use date, initials of the preparer, and the pharmacist performing the final check. So that's in line with what was stated previously in the chapter, but I just wanted you to know what is specific to Louisiana. Now, most times when we compound, it's individual patients that we're compounding for, but sometimes we will do what's called batch compounding. So in batch compounding, we may do a number of piggybacks that are going to be used later. So a lot of times we'll use it for surgery or for certain units on the floor that use a lot of medications for a first dose kind of thing. It's not specific for a patient, so it's not really an on-demand product. So the label requirements are a little bit different. This is almost on the fringe of manufacturing. So what needs to go on a batch label? Well, we don't have the patient's name, so we need to have the name of the preparation with the name and the amount of the drug added, the admixture solution or diluent that's used, the total volume that's in the bag, so the route of administration, special storage, and like when we do extemporaneous compounding, we have to have a lot number or a control number, as well as beyond use date. So that makes it a little different than your individual compounds for your on-demand for patients. Sterile compound label verification and application. Generally, what we should do is once we've entered the order and we've generated the label, we should go back and look at the original order and make sure it matches everything that's on the label and something hasn't been entered inaccurately. So that helps ensure the 5 rights, which now actually are 6, right patient, right drug, right dose, right route, right time, and now I've got to remember what the 6th one is. Amount, I believe. No, that would be dose. I'll have to go back and check on that. Sterile product labels must be legible and pharmaceutically elegant. We don't want them looking messy. We can't have any whiteout. We can't have any crossouts. And it must have all of the complete information. All right, now it's your turn. The physician's initial order is called this. So the initial physician's order is called an admissions order. All right. The CSP label provides all of the following information except that would be the patient's diagnosis. We have to have the storage requirements, the administration rate, and the patient identification number. All right. So now there's some questions for you to answer.